Clinical varieties of chronic urethritis. The preceding array of symptoms fails to give a picture of chronic gonorrhea. To obtain this, we must sum up the clinical types of the disease in a few brief paragraphs. All cases of chronic urethritis may be classed as follows: 1. Mild cases, 2. Intractable cases, 3. Relapsing cases, 4. Irritable cases, 5. Neurotic cases. 1. Mild cases, 2. Intractable cases. Although most chronic inflammations of the urethra are mild in their symptoms, few of them are mild in responding promptly to treatment. A slight discharge is all that marks the usual case, yet this discharge may be utterly intractable. Rapidly curable cases are usually those in which the prostate is neither markedly inflamed nor hypertrophied, the inflammation post-gonocoxic, the patient tractable and in good surroundings and health. Conversely, any complication, especially severe prostatitis, the presence of gonococci, or bad general conditions are inimical to a cure. 3. Relapsing cases. Every case of chronic urethritis has some tendency to relapse after a cure has apparently been effected. But certain urethrae show a tendency in this respect little less than maddening. Perhaps the patient has been carried successfully through an acute gonorrhea by repressive treatment when an unexpected outbreak of the disease disappoints surgeon and patient alike. Or a chronic case may have gradually yielded to methodical treatment only to burst out afresh at the slightest provocation. It is absolutely essential to know before pronouncing a patient cured that his urethra and prostate no longer harbor gonococci. This fact ascertained, we may at least assure him against severe or infectious relapses. The cause of relapse is a collection of pus in some gland or follicle. Its occasion may be alcohol, sexual excess, a cold in the head, or overzealous local treatment. 4. Irritable cases. The irritability of some urethrae is such as to prohibit local treatment, whether because of the pain and spasm evoked or because of an outburst of acute inflammation in the urethra, the prostate, the vesicle, or the epididymis follows every instrumentation. This local irritability, while in a sense peculiar to the individual, is usually the result of habitual disregard of the rules of prudence. The patient is either a hard drinker or addicted to sexual excess or overworked and overworried. Or, and this alternative is, unfortunately, not a rare one, he has been irritated by local treatment. An appreciation of this fact will help to direct the treatment of such cases. 5. Neurotic cases. The neuroses are not always due to antecedent gonorrhea, and it is only exceptionally that one encounters evidence of neurosis while the inflammation still continues. The neurotic taint adds many and various symptoms to those of the inflammation and protracts the patient's miseries even after his prostate has apparently returned to its normal state. But most of the so-called neuroses are due to the inflammation about the verumontanum.